The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala, and this is Thomas Benarat. Tom is a personal injury attorney, specializes in cases where people have been injured in automobile accidents and other injuries, and he also does work in malpractice situations. So we've been doing a series on risk analysis, long-term effects of whiplash injuries. We've already done the acute or early onset effects of whiplash injuries, and now we're doing part 2. And Mr. Benarat is going to begin by showing you a video of very often what happens even in low-impact auto collisions. The one that you're going to see and he's going to discuss is from the rear. But of course, some people are hit from the side, and some people are hit from the front, and of course, some people roll over. Their vehicles are caused to roll over. So when they run that video, Mr. Benarat is going to explain what happens, and very often people aren't even aware of this. So there it is.
This is an illustration of a rear impact as discussed, and as you can see too, one of the things that I have heard and insurance companies talk about too is that when you get hit from the rear, the logical thing a lot of people think is they'd first go forward, and in fact you go the opposite direction. As you can see here, the head snaps back. The impact itself at 4 miles an hour, but the vehicle acting as a propulsion actually speeds the body up to 5 miles an hour. What you'll look at here as it slows down is you'll see the back arch, the head raise, and when it goes back and hits the headrest, you'll note where it hits and that it's high enough that the head snaps, the glasses fly off, again showing the force. And in this case, the neck is also turned kind of to the right. Again, an important feature because in this situation, if the person and everything happens so fast, they may not know their head's turned right. But when you can see it here, it would logically follow that they're going to have more of a right-sided impact in the cervical spine or neck than they would if the head were straight. Again, though, it's a 4 mile an hour impact, but it shows the gravity of what happens, especially when you slow it down and you can see it real carefully move through. No damage to the rear of the vehicle, at least visibly. However, inside the bumper, there's a cushion inside that's a couple inches thick typically. There would almost certainly be damage either underneath the vehicle or in that bumper itself, where the padding in there that's set up to take the impact out would either be crumbled. Okay. Here's it speed up a little bit. When you look at this, you can clearly see a difference between the 4 mile an hour impact and the 9 mile an hour. The head snaps faster, the glasses are flying up higher and off into the back seat. And again, it incrementally causes an increase in the speed of the body because the vehicle, again, acts as a propulsion to do that.
So the law of physics, the head and body goes towards the force.
Correct.
And then whips.
Correct.
So that's how they come up with the term whiplash. So
correct.
The force is in the rear, so his head and back is going to the rear.
Yeah, and interestingly, I mean, one of the things when I used to be an insurance adjuster before I went to law school, a lot of times the insurance companies try to use different things to identify the truthfulness of the person. They always kind of teach you, it's an opposite effect. If you get hit, you don't go forward, although a lot of people describe it that way. In effect, it's probably because it happened so quickly. They didn't know what happened. They're just uneducated, and you think that that's logically what you would do when you go the other direction.
Yeah, and in the claims adjusters, I've, as you know, taught seminars for major personal injury and workers' comp insurance companies, and they've always treated me very, very well. I'm educating them or attempting to about chiropractic, and they want to learn. And that's their business, to try and find out what's the truth in that. And so I like insurance companies. I've never had a claims adjuster treat me badly or anything like that. And if there's differences of opinion, hey, that's life.
Right.
But if we've got the records, x-rays, thorough exams, we can substantiate, we can prove objectively that the person was injured,
right,
as opposed to just saying, oh, they were injured. Well,
right,
that doesn't help.
Yeah.
Well, we've got some x-rays that you brought along too that you were going to discuss, if I'm remembering correctly.
Correct. And we've got a cervical x-ray again here showing, I think maybe you can describe better than I, but it's essentially we've got a straightening of the cervical spine again.
Right.
I believe this is a post-collision impact.
That's right. And they're going to bring that up here in a minute, and we'll see that, or
There we
less
go.
than a minute. And so what we're going to see here on the far left in the red is this person has lost the normal forward sway. We're supposed to have 3 curves in our spine, one forward sway in the neck, a slight rounding between the shoulders, and a slight sway in the lower back. And this, because this person was injured in an automobile collision, those muscles were injured, they went into spasm, they tightened up, they became fixated, and it pulled the spine backwards, therefore losing that normal forward sway. And what's so important about that is the average human skull weighs between 8 and 10 pounds. And so when the curve has a normal forward sway, that weight of the skull is gradually dispersed on the fronts of the vertebra. In the situation of what we see here now, that weight is coming down on the backs of the vertebra, what are called facets, which are like shingles on a roof. They're pointing those out to you now with the pointer there. And so that predisposes them to facet syndrome, to arthritis, also to disc degeneration, and then to radicular symptoms that would be numbness, tingling, burning sensation in their arms, hands, legs, or shoulders. So now we're going to go to the next slide. And this is an individual that has lost the normal cervical spine, the normal cervical lordosis, and they're going to show you where 2 vertebrae are starting to grow together. Right there, they're starting to grow together. They're pointing that out to you, and there's actually some arthritis growing on the fronts of the vertebra, and those vertebrae are fusing. Now, that's not genetic or hereditary. That's a long-term effect that many people who have been involved in auto collisions experience years after the injury. Years after the injury. That's why, by and large, many of the patients that I see will have been injured, had some type of a neck or back injury many years ago, and now it's starting to show up. And most of those would not show up if they'd have had adequate care and adequate management.
Right. Early identification, early treatment prevents what we're talking about now, long-term problems.
Yes. To see is to know. If you don't see, you don't know. And if you don't see, for example, in an x-ray, you can't properly manage. It'd be like me asking your opinion and you not opening up a law book to see what the statute says. I mean, if you haven't had it memorized.
Right.
So then let's look at some, Tom, you brought along some slides about risk for long-term symptoms of whiplash. Certainly there's localized back pain. Do you want to begin discussing that?
Yeah, we can talk about that. There's a number of different things as we've talked about along the way, but I mean, signs and symptoms, localized back pain or pain that's there that, again, isn't treated, and probably one of the big ones that is often looked at and measured early on in a case and then measured as time goes to determine improvement is the range of motion that one has in both their cervical spine or their neck, the mid-back or the thoracic spine, as well as the low back. Certainly a restriction in your range of motion, or either a great limitation and or even going the other direction where you have a lot more flexibility than you would have, all suggests an injury that probably was prompted by that car crash that you were involved in.
And again, if the chiropractor or medical doctor doesn't perform the regular, standard, routine ranges of motion, how do we know if it's working or not?
Right. Well, and then the other thing is at that point, and then it's an objective measure again, too, that shows whether or not there is or is not an improvement over the course of treatment. Is it helping the person get better, which becomes important during the legal case to arguing that what's going on is really showing and helping the person improve.
Exactly. And so it says, if you don't measure, you can't manage.
Correct. Well, it's an objective way to do it, too. I can say that I can do more, but if I don't really know and I don't measure it, it's hard to quantify it.
How about anything else that happens as time goes on and the condition becomes more chronic?
Well, there's a number of things that can happen if it's not. The pain can worsen. You can develop extremity pain or weakness. If I've got a cervical problem that, I get numbness, tingling, pain that runs down either the behind the elbow and the ulnar nerve or otherwise.
Into the fingers.
Into the fingers. Sometimes, it could almost feel like your hand's asleep.
Yeah, often misdiagnosed as carpal tunnel syndrome.
I was going to say that too, and or otherwise even just a loss of grip
strength. And there's an instrument called a dynamometer, grip strength. And if the doctor doesn't measure it, how can I know?
Right. Right.
Until it gets to the point that when I try and lift up a cup of coffee, it falls down, or take off a
Right.
cap of a bottle.
Yeah. You'd see it only when it became significant, when again it's far enough along that it's difficult to return to where it would be if you'd have caught it at an earlier point in time.
And those tests should be measured initially.
Correct.
Not just say, get on the table, here's a couple x-rays, or none.
Correct.
Mm-hmm.
Yeah.
Well, do you have anything else to add there before we go to these anatomy slides?
And I think the anatomy slide is going to cover probably the radiculitis
Yeah, that's a
topic.
good idea. So we're going to bring up a slide now. There's 3 nervous systems in the human body. The cranial nervous system, that's touch, smell, sight. And then a peripheral nervous system, what we're seeing here. So those yellow lines that you see are representative of the larger nerves in the body. So up in the lower neck, lower cervical spine, upper thoracic spine, we have a root complex of nerves that come out of there. And also, even though it doesn't show it on this slide, arteries and veins and lymphatics and acupuncture meridians come out of that area. And that area is called the brachial plexus. And then as we go down into the mid-back, there are nerves and arteries and veins that run between the ribs. And then in the lower back, we have the sacral, or the lumbosacral plexus, and they're pointing that out now. And then those nerves affect all of the nerves right down to the tips of our toes. And there are orthopedic and neurological tests. They're very routine. All chiropractic students and medical students are trained in how to do these tests. They do not take a long time, but they are what help objectively substantiate subjective symptoms. So I could tell you, or Mr. Benarat could say to me, Dr. Lala, I have a headache. I can't see that headache. It's subjective. He can tell me his neck is stiff. That's subjective. But if I go and do ranges of motion on his neck, I can objectively evaluate that just as much as I can objectively evaluate those nerves. Now, another slide here about some of the risks. Cognitive dissonance, what is that?
Cognitive dissonance is one's ability to kind of differentiate. Sometimes you could look at it as between right and wrong, but also just the inability after a collision happens because of what's happened to me to differentiate even between things that I would have been able to before. I knew before that A, B, and C went in an order, and cognitive dissonance doesn't let me put those things together to get from A to C without difficulty and or not knowing whether or not I'm in the right place.
And because those neurotransmitters or hormones that affect how we think in those nerves and arteries and veins, if our brain has been traumatized or some area of our body where those hormones like dopamine or serotonin that affect our thinking and affect pain or being painless, then that person isn't going to think right.
Correct.
And so sometimes we begin to say, well, something's wrong with them. They're starting to call me John when my name is Gerald.
Right.
Or they're saying, well, I forgot where I put my keys. Oh, I remember now. And they just say, well, you're getting old. Or what do they call that? Too many, trying to multitask. And so very often if the doctor doesn't question those areas, they're skipped by, and many patients I find don't want to talk about them because they think, well, I'm getting old, or I don't want them to think I'm getting senile, or
Right.
something like that.
Or even just the fear of a change that they don't have an explanation for. And again, cognitive dissonance doesn't necessarily let them think through what's going on.
That's right.
Causes depression, causes anxiety, can cause other issues with, like we talked about in one of the other shows, digestion, menstrual cycles, bladder
Right.
issues.
Our next slide will show that too. And that brings up that many of the people have been to an emergency room in a hospital, or they've been to a medical doctor where some analgesic has been prescribed. And that's fine and dandy. We don't necessarily want them to suffer with pain. But a drug, as good as it can be, has a couple different things. It's like frosting on top of burnt cake, so it masks or covers up the symptoms, as well as it begins to throw off other biochemical activities of the body, and then we call those adverse reactions. So now, going back to the discussion that Mr. Benarat mentioned here very briefly, digestive and menstrual issues, we'll look at another nervous system on a slide here, and this is called the autonomic nervous system. Of course, auto in Latin means self-functioning. This is a nervous system that has your heart beating, hopefully correctly, 72 beats or beats per minute right now, and has you breathing without thinking about it. It's digesting whatever you've had for whatever foods you've ingested today. It tells you when you have to urinate or defecate. And so this nervous system is autonomic. It runs by itself. but it is also controlled. Those nerves come down from the brain, down through the spinal cord, and they pass out through little holes in the vertebra that we're going to look at in a couple minutes, called intervertebral foramina. So many times people will not have like a neck or a back pain per se, but they'll begin to have dysmenorrhea or menstrual cramps, or maybe he has excessive urination now. Maybe his libido is decreased. He can't get an erection, or the type of erection he had prior to the accident, or all of a sudden he's starting to have heart palpitation or breathing difficulty. And so it all goes back to the autonomic nervous system. And how do we determine that? Through objective tests. Testing. To see is to know.
Objective test, thorough history.
So as we were talking on the next slide, we talked a little bit about drugs, and they'll bring that up for us now. Of course, they mask symptoms. We're in no way anti-drug or anything, no way at all. But we want to treat the injuries and get them. We don't want to leave them untreated or mask them with drugs, because it predisposes the person to chronic degenerative problems, physical and emotional disabilities. And then we're going to look at another slide that's going to compare. Mr. Benarat's going to do this, is going to compare what a normal or near normal cervical spine should look like from the side view or lateral view, and what they often, very, very commonly look like after whiplash injuries.
On the right, obviously, the kind of the cervical curve, then again in the C shape, the way you want it to be. On the left is a cervical spine with someone that's been in a collision, maybe a rear end collision, for instance, where you can see that the vertebral bodies they're out of alignment, they're straight, probably caused by spasm or other muscle tightness because of what's happened with the rear end collision and the after effects of it. As that goes on, if untreated again, causes friction between those bodies, causes degeneration and other things that will affect you for your lifetime. The longer it goes untreated, the more effect it'll have.
And so some of the common residual symptoms, they're going to bring up a slide for you, are sleep disturbances, pain that radiates into the lower or upper extremity, spinal subluxation that we're going to look at here in a minute, muscle spasms, as Mr. Benarat has mentioned, rigidity fixation, and headaches. Now we're going to look at what is called a subluxation, and this is what the chiropractor is especially. He or she is the only one who is really educated in how to determine these, as well as how to correct them naturally. So we're looking at an illustration of several vertebrae. A is a normal disc. B is called an intervertebral foramina, where the nerves pass out from the spinal cord. Of course, just not nerves, but arteries, veins, lymphatics, and acupuncture meridians. They're identifying that for you. Then there's a normal vertebra there, and C is the normal nerve. That yellow worm-like projection is a nerve, but again, that's passing out of a piece of anatomy called the intervertebral foramina. And again, just not only nerves pass out of it, but arteries, nerves, veins, lymphatics, and acupuncture meridians. And if we go back up a little bit, we're going to see that the disc up there, the second disc, is kind of slipped forward. Now the vertebra itself, they're showing it to you, good, and it's thicker out front and narrow in the back, so it's changing its symmetry. Now when we look at D, that vertebra is a subluxation. 80% of vertebrae go posterior or backwards in whiplash type injuries, and so that's slipped backwards. And if we go down to E, the red colored disc there, the disc has become badly wedged like a doorstop. If we look at F, that nerve now is an illustration under F of what happens to those nerves, arteries, veins, lymphatic, and acupuncture meridians. They become smaller, they begin to atrophy, and of course if I have 100% of water flowing through a hose, I'm going to have 100% outlet. If I only have 50%, if my car is parked on the hose, it's going to cut down, let's say, the water 50%. That's what's going to happen to your nerve and blood supply. So the chiropractor, through x-rays and examination, is designed to identify those subluxations, those disc issues as well. Now we're going to look at a couple of vertebrae that are in alignment. These are illustrations or practical examples of them. We're looking at the back of two vertebrae. In the center we see a hole there and a yellow object that would represent the spinal cord, and those, there you see the nerves, they're pointing those out to you. Now if we look out at the sides, you'll see that where the nerves come out. And again, not just nerves come out of there, but arteries, nerves, veins, and lymphatics. Now we're going to look at the next slide, and we're going to see those same two vertebrae that are illustrated that are subluxated. They're out of alignment. So if we look at the white, now there we are. They're bringing that back and forth for you. Those white projections in the center, the one at top is shifted way to the right. Now he's going to go back. You'll see that that's misaligned. That's a subluxation or a minor dislocation. So it's not only going to affect how your back feels, but all of the structures, let's say your ribs are attached to those vertebrae, as well as the nerves, arteries, and veins that are coming out there. So now, enough of that. Let's go to our next slide. And what happens when these subluxations go uncorrected? Very often, commonly, arthritis, disc degeneration. On MRIs, they often, the radiologist will say foraminal stenosis and hypolordosis, the word that you see, hypo meaning under. That's what Mr. Benarad has been talking about, where the cervical, the normal C-curve in the cervical spine begins to be lost. It is reversed, and that's what contributes not only to a lot of neck problems, but it contributes to people developing what are called buffalo or dowager's humps in the lower neck and in the upper back. So you see these bumps starting there. And I'll say to patients, well, how long have you had that? And they'll say, gee, I didn't even know I had that. And I'll say, okay, so it probably wasn't pre-existing, because, you know, that's something that we would know about. And I'll say, well, now, just to make sure, if the mother is alive and if they have sisters or brothers, do any of them have that kind of curve in the family? No, I'm the only one. And then we take also digital photographs so that they can see it. And they say, I wonder where that came from. Well, if we leave these conditions undiagnosed and untreated, then we're going to have those kinds of problems. So let's go to this last slide, or these last couple slides now. What should a person do? As a legal counsel, as a respected attorney in the legal community here, and certainly I know you're respected by medical doctors and all other healthcare practitioners, chiropractors, what would you as an attorney suggest if a person has been involved in some type of personal injury?
Okay. If you're in a collision, your best bet is always to get checked out, okay, for a whole bunch of reasons, okay? Most prominently, you want to know if there's a problem. Getting checked out early allows for early detection. Early detection allows you to get treatment to help you get better, okay? It lets you document what complaints you have, okay? It leaves less room for questioning whether or not, in fact, you were hurt, but it also lets you even try to figure out objectively what may be wrong with you. You feel pain, you're not sure exactly where it's emanating from, but you can figure that out through objective measures. You want to do what you can as early as you can, so that you don't end up in this phase we're talking about now with long-term problems that will affect you for your lifetime. The longer you delay, the more likely you are to have a long-term problem.
The more you allow plaque to build up on your teeth, the more it's going to predispose you to dental problems.
Good analogy. Mm-hmm. Good analogy. The other thing too, just to go back just a few minutes ago when we were showing the slide with the discs, the one other thing there that we look at is you get the referred pain element to it too. And again, you don't always know. I've got all of a sudden now I've got pain in my mid back that's a little bit, but now I've got wraparound pain. Again, I think all these things as lay people we know a fair amount about certain things, but we should leave it to specialists like yourself who can help put together maybe the pieces of the puzzle to try to figure out why something's wrong with me that I didn't have before that logically follows it's probably from the collision, but the question is why.
Mm-hmm. I see then that you have a slide that says you have an insurance policy for a reason. Could you tell us what you mean by that?
Absolutely. A lot of people, especially in Minnesota, where we have a tendency to sometimes be stoic. We want to do the right thing. I'm not saying that it's not a good idea. If you're in a collision, sometimes it's okay to wait a little while and see if it gets, if it goes away. But if pain persists, you're better off, before you delay too long, get into the doctor, okay? Get in to see your chiropractor, get in and be assessed. If I get rear-ended in a collision, it's not my fault. It will have absolutely no effect on my premium. I have a legal right. I pay a premium for a reason. I have an insurance policy for a reason. Use it.
And that's the Minnesota fault law? Have you just defined what the Minnesota fault law, or is there another discussion or description of Minnesota fault law?
Well, in Minnesota, and people you can get confused by it a little bit, but the reality is we're in a no-fault state, which just simply means if I get injured in a car crash, I go to my own insurance if I have it to get my bills paid. If I don't, there's a number of steps you go through that we covered in an earlier session that can be viewed. But I mean, the
So
reality.
is that the only aspect of Minnesota no-fault law then?
Well, there's a number of different
So is that
aspects.
what's the difference between medical and, is it liability, or what's that other part?
Yeah, well, it goes like this. If I get injured in a car crash, if I'm rear-ended, I have the right to go to my own insurance to get my medical bills, wage loss, and some other things, such as if I can't take care of things around home, I have the right to get those paid for. That's kind of the no-fault aspect.
So do they also then, if you or I are injured in an automobile collision, do we have freedom of choice to go to whatever medical, chiropractic, dental facility that we want to?
Just like you have the right to go anywhere to get your car fixed, you have the right to go anywhere you wish to get your medical care and treatment.
Does that include if I'm in a managed healthcare program and I can only go to practitioners that they say I have to go to that are in the book? Can I go out of network then?
You absolutely can go out of network because your health insurance is not paying for your bills, your auto insurance is. You have the right to go anywhere you wish to get your medical bills taken care of.
Regardless of what the insurance company might say, huh?
Regardless.
But I think I've only had one incident in several years that said that they couldn't, you know.
Yeah, it's rare that they're going to try to dictate where you can go. They may do it in a roundabout sort of way. But yeah, if you get injured in a crash, you have the right to seek medical care from the individual that you wish. Okay. They can't tell you where to get your car fixed. They can't tell you who to treat with. Okay. They can maybe make a recommendation if you ask. Right.
Well, let's say that I have a broken windshield, and they say that their people will fix it for $1,000, and I go to some other place and it's $1,100. Does that mean they don't have to pay the $100?
No, they might end up in a discrepancy with the company that made the repair, but it still doesn't mean that you have to go to their person whether the cost is different or not. It may just be a dispute over what the reasonable rate is.
Well, then what does liability mean?
Liability gives you the right to collect for anything that basically the no-fault policy won't cover, such as maybe pain and suffering, maybe even medical expenses that went over what the no-fault limit is.
What about if you drive to the hospital or the chiropractor's office for treatment?
That oftentimes, like your mileage, can get compensated under the no-fault part of the policy too.
What if I lose time from work?
You should get compensated there as well.
So-
Basically what insurance is designed to do is put you back in the position you would have been but for whatever's happened to you. So either through the no-fault policy or the liability policy, you should be compensated for what you've gone through and the losses you've suffered.
What about then, let's say that I'm a truck driver or a secretary, administrative assistant, whatever the occupation, and my salary is $4,000 a month, and I can't work for 2 or 3 weeks or a month. Does that mean that they will pay my $4,000 a month salary? Does the law require them to do that?
Well, not necessarily. It requires them to pay part of it under the no-fault policy. It probably behooves you, if you're the injured person, to seek out some kind of representative such as myself to try to help you figure out what your rights are.
Can you think of anything else that's relative to that, to no fault, or anything you'd want to say to the people?
Well, I think the bottom line is your best bet is, if you're injured in a car crash, if you don't know what your rights are, to try to pick up the phone and try to talk to somebody that can help you walk through everything, so you know what you should be getting, such as mileage. Okay. If you can't do things around home, if you can't mow the lawn
In
anymore,
other words, if I had to have somebody come in and do the yard work, or if I went to the beauty parlor or had my nails done or whatever.
right. Yeah. Anything you could do before that you can't do now, that either if you have to pay for it, or even if somebody else is doing it for free and you were doing it before, you have a right under Minnesota no-fault law to get that compensated.
Interesting, very interesting. Well, been a great series that we've done. Thank you that Mr. Benarat has taken all of his time out of his busy practice and family to come in and share all about whiplash injuries. He's a very knowledgeable man, and I personally would highly recommend him.